AIDS, or acquired immune deficiency syndrome, is a significant global health issue that emerged in the early 1980s, caused by the human immunodeficiency virus, HIV. The origin of AIDS can be traced back to a type of chimpanzee in Central Africa, the likely source of HIV. The virus is believed to have been transmitted to humans when they came into contact with infected chimpanzee blood during hunting activities. This zoonotic transfer likely occurred in the early 20th century, but HIV remained unrecognized until several decades later when it began to spread more widely among human populations. The spread of HIV was initially rapid and largely unchecked due to the lack of understanding about the virus. In its early years, HIV transmission routes were not well known, which led to the virus spreading through blood transfusions, shared needles among drug users, and unprotected sexual contact. The virus can also be transmitted from mother to child during childbirth or breastfeeding, contributing to its spread in many regions. Additionally, the stigma associated with HIV/AIDS in its early years led to misinformation and inadequate responses from both the public and health sectors, further exacerbating the crisis. The global response to the HIV/AIDS epidemic has evolved over the years, but understanding its origins and pathways of transmission remains crucial for prevention, education, and treatment efforts. If you're interested in more detailed studies or literature on this topic, there are numerous resources available that delve into the historical and medical aspects of HIV/AIDS. AIDS, caused by the human immunodeficiency virus, HIV, has been one of the most devastating pandemics in modern history, affecting millions of lives worldwide since it was first recognized in the early 1980s. The impact of HIV/AIDS extends far beyond health, affecting economic and social structures, particularly in heavily affected regions like sub-Saharan Africa. Economically, the epidemic has strained healthcare systems, reduced workforce productivity, and increased poverty. Socially, it has led to the orphaning of millions of children and exacerbated issues of inequality and stigmatization. Efforts to prevent HIV infection have evolved significantly over the years and now encompass a wide range of strategies. Education and awareness campaigns have been crucial, focusing on how HIV is transmitted and promoting safer practices such as the use of condoms and clean needles. Such campaigns often target high-risk behaviors and support community engagement to dispel myths and reduce stigma associated with the disease. Medical advancements have dramatically changed the landscape of HIV prevention and treatment. The widespread availability of HIV testing has enabled early detection and treatment, which is key in managing the disease and preventing its spread. Antiretroviral therapy, ART, has proven to be a cornerstone of HIV management, significantly reducing the viral load in patients to undetectable levels and thereby decreasing the risk of transmission. Pre-exposure prophylaxis, PrEP, and post-exposure prophylaxis, PEP, are additional medical interventions that have been effective in preventing the spread of HIV. PrEP is used by HIV-negative individuals at high risk of contracting the virus, while PEP is employed immediately after potential exposure to the virus to prevent infection. Programs like needle exchange have been implemented to combat HIV transmission among intravenous drug users by providing clean needles and thereby reducing needle sharing. Moreover, efforts to prevent mother-to-child transmission during pregnancy, childbirth, or breastfeeding have been successful, involving the administration of medications to HIV-positive mothers. These multifaceted approaches to combating HIV/AIDS, combining medical, social, and educational strategies, continue to evolve, driven by ongoing research, funding, and international cooperation aimed at reducing both the incidence of HIV and its profound impact on societies around the world. Significant progress has been made in the global fight against HIV/AIDS, but the disease remains a major public health issue, affecting millions around the world. Treatment advances, particularly the widespread use of antiretroviral therapy, ART, have transformed HIV from a fatal disease into a manageable chronic condition for many, dramatically improving life expectancy for those living with the virus. This progress has led to a substantial decline in new HIV infections and AIDS-related deaths since the epidemic's peak. However, challenges remain, especially in regions like sub-Saharan Africa where the majority of those living with HIV reside. Despite these advances, stigma, discrimination, and inequality still pose significant barriers to HIV prevention and treatment efforts. Access to health care and HIV services varies widely, with some areas facing severe limitations that hinder effective response. Efforts to prevent HIV/AIDS are multifaceted and include several key strategies. Safe sexual practices, such as the consistent and correct use of condoms, are crucial for preventing HIV transmission during sexual activity. Regular HIV testing is encouraged for everyone at risk to allow for early treatment and to help prevent the spread of the virus. The principle of undetectable equals untransmittable, U equals U, underscores the importance of treatment as prevention. Antiretroviral therapy reduces the viral load in HIV-positive individuals to undetectable levels, nearly eliminating the risk of transmission. Pre-exposure prophylaxis, PrEP, and post-exposure prophylaxis, PEP, are medical treatments that significantly reduce the risk of HIV infection. PrEP is for HIV-negative individuals at high risk, and when taken daily, it is highly effective. PEP is used after potential exposure to the virus and must be started within 72 hours to be effective. Additionally, preventing mother-to-child transmission is a critical component of HIV prevention. Pregnant women living with HIV can take ART during pregnancy, delivery, and breastfeeding to significantly reduce the risk of transmitting HIV to their babies. Needle exchange programs are also vital, providing clean needles to people who use drugs intravenously, thus reducing the risk of HIV transmission through shared or reused needles. The global effort to combat HIV/AIDS requires continued funding and commitment to public health initiatives that adapt to and address the needs of vulnerable populations, ensuring that advances in prevention and treatment reach all those in need.